Dr. Reem Al-Shaikh, she's back. Hello.
Hello, thank you for having me.
How are you? Back by popular demand, I have to say. A couple of weeks ago, launched your episode, and I had so many messages from my friends being like, I'm such a fangirl of Dr. Reem Al-Shaikh.
That's embarrassing.
No, it's amazing. It's your like dedication to health is so impressive. As a doctor, we had that whole conversation. If you haven't heard it yet, go back a few episodes. You will hear everything about Dr. Reem's health routine, how you inspire patients. I've been feeling very inspired since that conversation. Thank you. And I think you inspired a lot of people along the way.
Well, I try. I mean, if I don't do it, why would you? So that's really how I look at things, really. You know, I've got to give it a go if I'm going to tell everyone else to do it.
So we're doing a slightly different format for this bonus episode that's coming out. I, as you know, I'm like a news journalist. So I've spent the last 8 years working in news. I love, discussing news stories, breaking news. So I wanted to go through some of the headlines in the health world that have been cropping up over the last couple of weeks.
Yep.
We can discuss them together. Firstly, though, I wanted to ask you how your health journey is going at the moment. I know
it's been a funny old time. Good on CrossFit. So I go to CrossFit, which is functional fitness. I do that 3 times a week, and I'm doing a bit of a bonus strength class every week now. And one of my really, really good friends is coming to that, and it actually really helps me kind of go, which is really nice. And I've been up and down with my nutrition, but I'm really trying hard, focusing again back on protein. I stopped tracking it for a while, and I think I just basically became a bit more complacent and wasn't really kind of doing what I wanted to be doing. So I'm sort of back on using my little free app to track my protein intake as well as fiber and other things. That's been good. So I'm trying. How's yours going?
It's going good, actually. Also, I wanted to add, you've been using a grounding sheet, which
I have.
Me and my husband, I think, did we give it to you for Christmas? Or we recommended it to
This
you?
is really interesting. And I grind my teeth quite a lot at night. And I've done that on and off for many years. And I have to hand wash my sheet, and in my life that hand washing lives in a little special basket until I get around to doing it, and it's currently in that, and I haven't used it this week. And what's really interesting is I am massively aware that I'm grinding my teeth more without it.
That's so funny.
It's really interesting. I mean, as a doctor myself, I haven't got a medical study to say that this grounding sheet's going to stop you grinding your teeth, but it's really interesting from a personal experience. It's not bad for me. I'm lying on a sheet and it's grounding me.
There are a few studies out there. I mean, I don't want to sound too woo-woo by saying go and get a grounding sheet, but there are a few, if you look at PubMed, there are quite a few studies now saying that there are benefits in terms of inflammation, stress, grinding. Some functional dentists, recommend them.
I know. And I've had a dentist say that to me. And even just walking outside, putting your bare feet on the grass in the morning does ground you.
Yeah.
And it does connect you to the earth in a way, and it helps your brain, and it sets you for the day. And there is something really, I think, just really fascinating and kind of, to some extent, really important about that. I was listening to the episode with Rob, who, I'm not going to lie, has sort of changed my whole outlook. So as a doctor in the UK...
So just to clarify, the episode with Rob was the one that just came out last week.
Literally. So your functional gut specialist. It's just funny, as a GP myself, I agree with what he says. We don't manage gut health well outside of the big kind of obvious things. And I was in a consultation the other day in my NHS life, and I thought this young woman had SIBO, which is small intestinal bowel overgrowth. And I thought, I've got no means as a GP to actually prove that. I'm going to have to refer you to gastroenterology. That might take a year or so for you to get to them. They may or may not do a breath test. And it is really interesting that you have to kind of, as you did, as you are doing, navigate your gut health a little bit all by yourself with the help of specialists like Rob. And I just thought the episode was really interesting. I'd encourage anyone who's a bit skeptical to listen to it, because he was so just so practical and logical. I just thought you can't argue with what he's saying, because he's not saying don't use traditional Western medicine.
Antibiotics needed
absolutely.
certain times.
He's just saying, but the root cause is always the root cause, and rather than manage symptoms, get to the bottom of what's going on, and guess what? Your symptoms might just go away.
Yeah.
And I just thought, I can't argue with that. I was
Do you know
really
what?
impressed.
I've got to say, so I'm trying to be a bit more authentic, because I think working in news, you're not really yourself.
Yeah.
You're always a character who never shows emotion, who never kind of reveals what's going on. I have to say, when I recorded that episode with Rob, I was really in the depths of doing my gut health journey. So I mentioned in the other episode, if you haven't listened yet, please do go and listen to it, because it is fantastic in terms of learning about how your gut health really like affects your whole body. I was diagnosed with SIBO. Huge amounts of people have it. There is now a lot of evidence to suggest that some people with IBS actually have SIBO, but a lot of doctors are just not able to diagnose it.
Yep.
So I've been going through this really intensive treatment of basically being on a low FODMAP diet, which a lot of people do, you know, who have IBS or other gut problems. But I've also been on these antimicrobial supplements and on quite a restrictive diet. But I had the sort of die-off reaction that was quite bad. So
he talked about that.
He talked about that, and it's when you have a lot of this overgrowth or bad things living in your gut, it can kind of, if you've got the leaky gut, so the permeable sort of gut lining, it can leak into the body and make you feel absolutely terrible. And I had that. And I was really going through that when I was recording the episode, which kind of made it all a bit more real.
Yeah.
Since then, I mean, have been feeling amazing, managed to clearly clear out a lot of this bacterial overgrowth that was living in my small intestine. So I am feeling like a new person. Honestly,
so
it's amazing.
I think that what I want people to hear from that is you've had this really interesting journey that you're still on and you feel better for it. You haven't done anything dangerous. You haven't taken any medication that I would say is bad for you. You know, I think there'll be a lot of skeptics listening to this conversation, especially with me being a standard NHS GP. And what I'd say is we don't really deeply understand our gut health, and what we offer within the NHS is not wrong. It's just what we offer. And there is so much more to understanding our microbiomes and how our gut has an effect on so many parts of our body. I don't think it's by accident that we're seeing more bowel cancer in younger and younger patients now. And I think our diet and our lifestyle has everything to do with that. And so I just kind of would like to urge people to listen to the episode, even if you go, oh my God, you know, a lot of medics go, oh, functional, that means bad, that means wrong.
Yeah.
So if you're skeptical, just listen to it, because I think you can't argue with it.
A lot of it's practical, and I can definitely say that, you know, I'm feeling really, really, really a lot better. And this is something I now realize I think I was suffering with for many years.
Could be.
Not just, you know, the last year or so. It's been a long time. So it's really nice to feel, you know, it's been a tough journey.
Yeah.
It's been an emotional roller coaster. And that's the thing with gut health. It's so linked to mental health. And a lot of people with gut issues also suffer with depression and anxiety.
Absolutely.
And yeah, so I feel almost like a huge new lease of life, which is great. But now on to the next stage, which he explains in the podcast episode, which is about kind of repairing the gut and rebalancing. And that is the future of kind of how do we stay healthy for a long period of time.
I mean, as you know, I do a lot of menopause and women's health specialist care. I get so many women in their menopause coming with gut issues. And actually, if we don't manage that, then we can't achieve what we want to achieve with hormones, let's say, because there's all these other problems at play. And unless we get the gut right, sleep right, and all these other aspects of their life right, then actually we can't move on with their symptoms. So is gut health important? Yes. Should everyone know about it? Absolutely yes. I wish it were better and that you could access more of these specialized sort of investigations and expertise. And to some extent you are navigating a little bit by yourself at the moment. But I think, you know, the real basics of, you know, fuel your body well. You know, most people in the UK do not eat enough fiber. I cannot say this enough. You need about 25 grams a day as a woman. And if you're not getting that, you need to be thinking about how you're going to introduce that, and always food first. So I know you mentioned some supplements, and it's different with what you're doing because you're on a treatment plan. But, you know, I really want to get across to patients that, you know, I think, you know, we've got to be thinking about what we eat. Because food is, you know, food, we're lucky, food's available. And we need to be picking the right food.
Yeah, absolutely. And I just want to also give a shout out. So we are doing a weekly newsletter, thehealthreview.com. So every Friday it's coming out. I'm basically giving a little summary of health news from the week. We've got lots of guest articles from you coming up about various supplements, health things, diet stuff. So if you want to hear more from Dr. Reem Al-Shaikh, do sign up to the newsletter. Just head to thehealthreview.com. And that will come out every Friday. I do want to go through these news stories.
Let's do it.
Some of the kind of big headlines, you would have heard of this one. I think most people would have heard of this one about the new pill for endometriosis that was approved in the UK for use, NHS England. It's officially been approved. It's taken a while to get there. This is the first ever sort of daily pill which can manage endometriosis symptoms. So this is quite groundbreaking. It's being called game-changing, this treatment. It can be taken at home. But there is a caveat that it's really only for a very few number of people.
I think what everyone needs to understand is it can take about a decade or more for it even to be diagnosed. I think it can present quite vaguely. I think not every physician is in tune to what the symptoms are, and picking up early can really change a woman's life. It really, really can. So I think I want women to advocate for themselves. If you think you've got endometriosis, I want you to think about that, think about the symptoms, go to your doctor and say, I think it might be endometriosis because, how are you going to help me work this out? Ryco is the brand name of the new medication that's out. It is a pill. What it effectively does is it puts you into a chemical menopause. So it basically stops your ovaries from producing estrogen and progesterone. Estrogen and progesterone drive your menstrual cycle, and if you've got endometriosis, it can make symptoms a lot worse. What this pill's got in it is an active ingredient that basically switches everything off, and it's got a bit of estradiol and a bit of norethistérone. So we're giving the woman add back HRT. Anyone who's being put into a chemical menopause needs a bit of HRT to take away any of the effects of being put into menopause. So they might get symptoms like hot flushes. So the very low dose of hormone that's given in that pill is to take away those symptoms, and also to protect their bones. So what's impressive about this drug is, like you just said, you can take it at home, you can take it every day, and it might massively improve especially the pain around endometriosis. We've been using it in the drug in the UK for some time for fibroids. So women who have benign lumps and bumps in the womb that can really severely cause heavy bleeding, we often use these drugs to get them ready for surgery or to manage their symptoms. There is an alternative drug that's available in the UK that's injectable, but you've got to go to your doctor. We have to inject this little pellet or liquid into your abdomen, and that's a hassle. And again, it's specialist treatment. Not every GP has specialist interest with women's health, and so again, you might have to go and see a gynecologist. So this is good news. Your GP is not going to be able to prescribe it for you to begin with. So you are going to need to be accessing this through a specialist gynecology clinic. So I think the thing I'd say to women is really, really good news, but this is going to be licensed. Well, not licensed, but the guidance is saying it really is only when everything else hasn't worked.
Including surgery, right? So it's for people who apparently have also had surgeries and it hasn't
I think
helped.
that we will see the gynecologists use this more sensibly, and I think that you will be seeing it. We do use the injectable medication often pre-surgery to see whether surgery would be successful. If we turn everything off, that's roughly equivalent to us taking it out. But with endometriosis, it's kind of complicated, but you can have other specific surgeries where we kind of go in and just remove the bits of the endometriosis. We're not taking away their womb necessarily or their ovaries necessarily. So I think it's good news. I think women aren't going to just be able to walk into the GP and ask for it. I think many GPs are going to, won't feel comfortable prescribing it. There will be GPs with specialist expertise who, as it stands at the moment, won't be able to prescribe it right now. But I think it's a bit of a watch this space. I think it's a step in the right direction for endo.
Absolutely. Good step in the right direction. Next one, a new immune system hidden power has been discovered. Scientists have found a new part of the immune system they weren't aware of before, a hidden mechanism that unleashes bacteria-killing chemicals. So it sounds like this breakthrough is sort of tapping into a part of the immune system we didn't know was there.
So in short, the way I would look at this is, imagine your body is, your body's your sacred home, and your body's got a security system, and that security system is protecting you against the basics, viruses, bacteria, things that are going to kill you. And your immune system is kind of like the security company that you employ to protect you. What this is saying is, at a cellular level, at the level of the cell is constantly breaking down proteins and taking out the rubbish. So it's constantly clearing rubbish out from your system, and it breaks things down. And what they've kind of noticed and found is that in that breakdown product of the proteins in the cell, we think that these cells at an individual level have their own little security system. So what they're saying is, it's not just the immune system being the security system that you employ to protect you in your home, which is your body, but we think every cell has its own mini little security system. And why is that important? That's important because actually you might be able to upregulate that. So rather than just say, here's a drug to make this bad bacteria go away, because what happens is your immune system alerts you when the intruder's in the house. So they've got in, they've broken down all the system, and now you're trying to fight it. And what this is actually saying is, maybe at a cellular level, we can actually prevent before the intruder even gets in. And that's quite interesting. That's kind of the way I look at it.
It sounds like a really big breakthrough and got some good press this week. So a lot of people are talking about it. Really intrigued by this one, a new sort of more natural alternative to Ozempic. Researchers at Stanford Medical medicine have found a new molecule called B.R.P. At the moment, only been sort of tested and discovered with mice and other animals.
Yes, what they did is they basically... Clever people have located. They sort of looked at loads of different kind of biomarkers. They've got down to this what we're going to call a molecule, and they think that this is going to affect your hunger. So they gave it to mice, and they basically observed whether or not, if they gave it to a mouse before the mouse ate, they basically observed that the mouse that had the molecule given to them ate 50% less than the other mice. So it's doing something to their hunger hormones. It's what I would say with this is we are going to see tons of new and improved versions of the active ingredients that are in all these injectables that we keep reading about, Ozempic, Mounjaro, etc. I think that we're going to look back on those drugs in 10 years and go, what were we doing? There's so many side effects. Yes. This is so much better. So I think what this is this is the beginning of the next step with obesity management. What we've got now is good, but what we're going to have is going to be better. And what they're saying is going to give you less side effects, and they want to do some animal and human studies. They're looking for, they're kind of setting up a research lab now to try and study this, which is pretty exciting.
Yes. So that, I guess, was one of the main takeaways with this, that perhaps the effects on the body were, well, for animals anyway, human studies are coming soon for this, apparently.
I'm sure it will. I think obesity management, obesity treatment, I think we're only in the very, 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 very beginning of this. There is so much more to come.
And I think one of the things to be aware of with these drugs like Ozempic are the loss of muscle mass.
Yes. And this is saying that these types of molecules might not do that. So I think, the kind of headline is obesity management is starting to get better. What I would say to anyone, just a bit of a plug here, anyone using injectable weight loss medication, you have to do this with the mindset that this is you forever, not just on that 1 to 2 years while you're on the drug. And I think that it's great that people are accessing the drug. And for many patients, this is the one thing they've been waiting for. They've not been able to break that cycle. This is going to get their weight down. But my fear is so many patients are accessing it here, there, and everywhere. Cheap pharmacy. I've got a discount code. They're not accessing the extra help that comes with the drugs. You have to pay extra for that. And I think that there is an issue at the moment. I think we're not going to necessarily see the big benefits we want to see because people aren't being supported through the use of the medication correctly. And if we don't get that right, then I think you're going to see people yo-yoing on them. And I don't think that's necessarily good for the patient.
No. But again, a good step in the right direction.
Absolutely.
More research going on. There's so much research going on in that area, which is very exciting. Curious about this one. Bacterial vaginosis. Researchers are now saying that it is or could also be classed as an STI. The key to this could be treating male partners.
It's really interesting. So bacterial vaginosis is something that, up until now we just thought was due to the environment in the woman's vagina. So it's something that occurs. It's a bacteria. It can give you smelly, fishy discharge. It makes you feel uncomfortable and give you pain, give you bleeding. We see it a lot in menopause, perimenopause, because the environment in the vagina is changing, becoming drier, and then infections tend to start. So it can become recurrent. Women can end up on cyclical antibiotics. The antibiotics that we give for this are really heavy duty, and they can make you feel quite unwell. They can upset your gut,
and then it leads to more BV.
Exactly. So Rob would lose his mind over this because we're just dishing out antibiotics. So it's a real big problem. And so this is, I think, an Australian study. They looked at about 160 odd couples. So they looked at basically couples, male, female couples who were only having sex with each other. Okay. And then what they did is they looked at the women who were getting BV. And then who got recurrent BV. And I think they treated one arm of the study, they treated just the woman. And in the other arm, they treated the woman and the male partner that she was having sex with antibiotics, even if he was asymptomatic. And what they saw was that in the group where they treated the woman and the man, there was a much lower percentage recurrence compared to the group where they only treated the women. So for example, I think it was roughly like in the group with the women, it was around, I don't know, around 60% recurrence. And like, I think in the group where they treated the man and the woman, it was around like, I think in the region of like 35% recurrence. So basically it is looking interestingly likely, but there is something about the fact that it could be sexually transmitted. And so right now, if you go to your doctor and you've got BV and you say, can my male partner have treatment? The answer is probably going to be no until we have more information, more studies. But it's really interesting. And it's something that I think that people who manage a lot of women's health have thought about for a long time, because you think, well, surely if it is a bacterial infection and you are having intimacy, surely you're passing it to and from, but we don't know. But it's quite exciting, I think, because BV is just so annoying. And it can be persistent, and it can really get a woman down.
And it affects around a third of women worldwide, and also in more severe cases can lead to infertility.
I mean, severe vaginal infections can track up into the uterus, into the womb, and then that can have an effect on your fertility, which is not good. It can cause other problems. It can cause relationship problems. A woman can feel really uncomfortable. It can make you feel heavy and make you not want to have sex. And then there's the emotional issue, and then the woman can start panicking that she smells, and you can get into these vicious cycles. And so the more we understand about BV, the better. I mean, from a personal experience, I think I see it so much in perimenopause and menopause. I'm going to share this. I had it in the last year, and I'm perimenopausal now. I've never had it in my whole life, and nothing about my sexual situation has changed. And I just thought, why have I got it? And I think it's quite important to test and be sure you've got it, because the treatment is antibiotics. There's a lot of really good stuff you can buy over the counter as well. So you can buy kind of lactobacilli gel inserts to get the kind of environment in the vagina sort of changed, and that can combat the BV. But it can be really annoying, and it can be. I can tell you this firsthand. It's really bloody uncomfortable.
Yeah.
And it can be very stressful to have an infection and to not understand why you have it, and then to not understand why it's not getting better.
And just before we wrap it up, I'd quite like to discuss this study about exercise. We already knew this was kind of a life hack, can improve all sorts of things, from anxiety, depression to cardiovascular health. But a new study found that regular exercise may lower your risk of dementia, stroke, anxiety, depression, and sleep disorders by up to 40%. That number is significant, isn't it?
I mean, for me, how can moving more be bad for us?
Yeah.
So, if you move, if you run, if you cardiovascularly push yourself, if you weight train, you're metabolically improving your system, you're improving how you manage sugar, you improve visceral fat, which is the bad, unhealthy fat, you improve blood flow, your blood vessels are healthier, you can start to kind of put it all together and go, well, it makes sense. If I'm in a really healthy, optimal state, well, obviously my cognitive function will be better, my blood flow will be better. I mean, I love that we're seeing this type of study and information coming out, but I would say to everyone, you don't need a clinical trial to understand that we as humans were not designed to be sedentary.
No.
Everybody needs to be moving and really mindfully moving and getting up every day and exercising and pushing themselves, because it will lead to a happier, healthier, longer, joyful, active life. And, from a longevity perspective, because, I'm approaching midlife and I'm really interested in thinking about the next 10, 20, 30, 40, 50, what do I want to be doing now to make sure that I get there well? What do we all need to be doing, especially with our young children as well? Is you need to be setting really good kind of expectations, and the environment needs to be right. If the family gets up and exercises together, then that's just normal. That child just understands that they need to be moving and it's good for them. I think it's I just thought it was what a nice story.
What's interesting about this is that they used a large UK database, researchers, of over 73,000 people. So this wasn't just a small study of 100 people. This was a huge amount of data with the average age of 56. And the research also found that prolonged sitting was linked to an increased likelihood of developing those conditions that were mentioned at the start. So sedentary lifestyle, not good. Exercise, movement where possible, even if it's just, a walk where you get a little bit breathless. That's really helpful.
Too much. We stay still too much. I think that, we need to kind of push ourselves to do more. If you are in an office job, can you stand at your desk? Can you have a treadmill under your desk? Can you go for a walk in the middle of the day? Can you commute better to work? Can you drive and park your car 10, 15 minutes away from where you need to go and run or walk or jog or whatever you want to do to get there? There are ways to move. You've just got to commit to finding those ways.
Yeah.
There are ways to move.
Yeah, absolutely.
There really are.
I've started a new hack now. If I'm at home and I've been sort of editing episodes and things which can take a long time, and I notice I've been sat down for a long time, I'll get up and I'll just do like 20 squats, or just a plank 100%. For like a minute, and then get back to it. Like, oh, okay, feel a bit better, got a bit more energized, and probably getting the blood flow going.
A lot of people are on conference calls, right, and they're working from home, and they may or may not have their video on. It depends what your job is, right? You could be doing air squats at that point. You could be wearing a weighted vest and doing air squats. I've done a meeting before where I was chatting to someone and I'm doing a plank. They can't see what I'm doing as long as I can breathe and I can have my conversation. There's tons of things you can do. I'm often, sit in my practice and I'm sort of shaking my legs around and getting my circulation going. And so I think, I I think that the take-home message for me for everyone is active, active, active.
Yeah.
Over anything else.
That is the take-home message, and that is the end of our bonus episode. Dr. Reem Al-Shaikh, thank you so much for coming on, popping in. We're going to go for a nice yummy brunch now and have fun.
Thanks for having me.
Thank you.